We would like to acknowledge the traditional owners and custodians of the lands on which we and all of you meet. We pay our respects to elders past, present, and emerging.
Welcome to the podcast, Sex, Love and Science with Lauren and Lauren, two sex and relationship experts.
We will address all of the big issues in sex, love, and relationships.
We recognize that humanity is diverse. All bodies, orientations, and sexualities are welcome. Welcome back. This is Lauren Muratori.
And I'm Lauren Bradley. Welcome to Sex, Love and Science.
Today we are doing sexual pain. Oof, a big one.
Yeah, sexual pain is so common, incredibly common. In fact, as many as 75% of vulva owners experience some kind of sexual pain in the course of their lifetime. That's from the American College of Obstetricians and Gynecologists.
That's way too many.
Yeah, that is way too many.
I'm sorry, but that's too many.
It's so common, right? And also for penis owners, sexual pain can be common, though far less so, according to the research.
True, and actually that kind of correlates with presenting issues in my practice.
Yeah, we see approximately 1 to 5% of penis owners experiencing pain through sexual intercourse. We'd love to see more diverse research about all the different kinds of sex-identifying characteristics people have and their pain as well.
Good point. Today's show, though, I think we're going to talk more about vulva owner pain, just to let you guys know out there.
Yeah, so we do have some beautiful things to look at around vulva owner pain. So if you are one of the 75% of people that have experienced pain, or you are experiencing pain at this point, then this show is for you. Or if you like to have sex with a vulva owner and you want to make sure that they're comfortable and having pleasure, then this episode is also for you.
Ooh, good point.
So I guess the first part we want to speak about in this is how common it is.
Yeah. I would say I probably would have at least a couple sessions a day about vaginal pain.
Yeah, I really commonly see this with clients coming in with, there's a big difference too between discomfort and pain.
Oh, absolutely.
And what we're talking about here is, sex can be a little bit uncomfortable at times, and they can be awkward moments, or they may be, incidental moments of pain where you're in the wrong position and that's a little bit painful. But what we're also talking about here is more chronic pain, more long-term pain around sexual intercourse. And we're particularly talking about that and all forms of sex too, actually.
Yes, good point, because we don't have to just be talking about penis and vagina.
Well, one of the big factors isn't actually a condition at all, and that is lack of readiness.
Oh, so true.
So we're talking about here, lack of lubrication, lack of readiness, lack of muscles being actually ready to experience sexual pleasure. And what we find is a lot of people present clinically in sex therapy saying, I'm having painful sex. And there's actually nothing wrong with their body parts at all. But what they're actually doing is starting maybe penetration earlier than their body is ready for it.
Yeah. Or they're having so many intrusive negative thoughts that are just putting a total unsexy blanket all over your body and then expecting great results. So that's not going to happen either.
No, definitely not. Definitely not. It's a bit like, getting ready to go for a sprint and not even doing a warm up and just kind of jumping in and doing a sprint. Of course you're going to hurt, right? You need to be physiologically ready to engage in this kind of activity. And what we know from the research is that it does take vulva owners 20 to 40 minutes of arousal time to be ready. You're listening, penis owners? 20 to 40 minutes, right? That's a long time. So we're talking about when someone is actually keen to have sex, to actually get the body lubricated, to get the blood vessels engorged, to actually fully comfortably receive penetration. 20 to 40 minutes you should be spending in order to not have pain and discomfort.
And I just want to put a disclaimer in there because I love the word lubrication.
Mm-hmm.
With the word lubrication, there's a lot of myths and fallacies going around that you shouldn't use lube, or because my vagina isn't wet, that I'm not aroused. Let's throw it away. Lube is your friend. Don't worry if your vagina's not getting naturally wet, or just buy some really good expensive lube. Splurge do not skimp.
Or get coconut oil. Actually, I find a lot of clients really like coconut oil, depending on what toys and barrier protection you're using. Could be a great option. But also too, it does need to be readiness. So you can't also use lubricant to disguise your lack of readiness or willingness to have sex. So don't feel like you can just slap lube on when you're not interested in having sex and have comfortable sex.
Totally.
So it's a bit of a dance. If you're feeling like there's what we call in our work arousal non-concordance, so your brain is ready for sex, but your body is not ready for sex, and your brain is keen and you're really keen, but maybe your vulva is not really quite there and you're not really lubricating in your vaginal muscles as you'd like, that's the time to start applying some lubricant and start to maybe explore comfortable, slow, easy penetration.
So true. And this is where toys, and outer play and, examining other parts of the body are going to be really important.
That's right. Yeah. But, lube isn't a fix-all approach. You can't just slap it on and say, yep, let's go. Penetration time. You need to actually be ready for it. Otherwise, you might still have pain even if you do use lube because you're not quite ready physiologically for it.
So true. And, a bit off topic, but I'm just going to link this to other episodes. As this goes back to, the desire discrepancy,
yes,
spontaneous or responsive desire, mismatched libidos and people wanting sex at different times. So this is all interwoven together.
Yeah. So if you want pain-free sex, you need to really focus on connecting yourself to feeling sexual and enjoying the sexual process. And that doesn't mean you have to feel like jumping your partner's bones, but it does mean you have to be in the mindset and the body mindset space to be engaging in this pleasure and to want it for yourself as well.
So true. Mindfulness. Oh, what a hot topic, a hot word of it. I think that we're going to pop into this episode a little bit.
We definitely will. So let's have a look at some of the most common kinds of pain that we might experience and some of the common reasons why we might experience pain. So I guess there are two kinds of pain that we commonly see with vulva owners. We can separate them into two categories. The first is deep pain. So this is deep inside the body. This pain could be endometriosis, which a lot of women are experiencing, and a lot of female and also a lot of vulva owners are experiencing at the moment, where we have, cells that line the uterus and growing in other parts of the body as well. So it's incredibly deep positions. It can actually be incredibly painful for these people to engage in sexual intercourse, and incredibly painful outside of sexual intercourse, and a real break for wanting sexual interaction too.
That is a really good point. Yes, it's the pain that's really outside of the bedroom too that is going to definitely throw the brakes on to wanting or motivating you to want to have sex.
Yeah. And, with a lot of vulva owners being diagnosed with endometriosis, this is giving a lot of people knowledge as to what some of the causes of their sexual pain or their body pain has been. And, to those people, we know how much the medical field has really neglected, vulva owner pain over the years. And we are really happy for you if you found a diagnosis so that you can actually get some answers for this for yourselves too. So just acknowledging that, vulva owner pain isn't taken necessarily that seriously as it should be. So we will do our best to try and support you in that way, but hopefully you can find other clinicians medically that can do so too.
So true. And from my knowledge, correct me if I'm wrong, Lauren, but the only way for a diagnosis would be through a laparoscopy. I do believe that gynos can say it sounds like you have endometriosis from what you're describing, but I do believe confirmation is via the surgery.
Yeah. And what I'm hearing as well is that a lot of people are doing that whilst they're getting some treatment for that at the same time. So it's a big commitment, a big procedure to do. So that's a big impost for a lot of people. A lot of people won't actually be doing that to get the diagnosis as well.
Yeah. So, I mean, just normalizing that for people, it just sucks. Like it's a process to go through, and well done you for if you've been through that.
Yeah. And, if you've lived with endometriosis and you have found some fantastic ways to connect to your sexuality, reach out to us. We would love to hear from you and maybe feature you in an episode.
Oh, yes.
Because I know this affects many people, many women and many vulva owners that I have seen in my lifetime as well have had this experience that have really learnt to connect to their sexuality again as well.
Good point.
So the next kind we see is adenomyosis, which is a condition where cells that line the uterus grow in the muscle around the uterus. Also a very painful condition sexually, but also outside of sex, you can experience pain too.
Yeah, and the deep pain that we're talking about is you can, if you're having sex, it's going to be that deep pain. I've heard people describe it as like somebody stabbing you from the inside, that there's might be a knife in your belly. It's that really deep pain.
Yeah, some people will say too, it's like they're hitting my cervix.
Yes, yeah.
Yeah, really painful experience. We also can have a prolapsed uterus. So this is where the womb drops down toward the vaginal opening. Really painful experience. We can have fibroids, which is growth in the womb.
So common, fibroids. And they do grow and shrink, from my knowledge.
Yeah, absolutely. We can have ovarian cysts.
Oh, those fluid sac. Has anybody had a ovarian cyst burst?
Ouch. I have seen that. I do follow a fantastic fitness person on Instagram who very much focuses on strength rather than aesthetics. Love it. She posts regularly about her experiences in that space and how it affects her pain levels and her ability to have energy and have spoons in her life. Really painful. Ouch.
Yeah, I've been through a bursting cyst.
Ooh.
You know, not the most fun thing you can ever do in your lifetime, but
ouch. Yeah, of course. And that's going to hurt for sexually and outside of sex as well.
I can't remember that part, but
black that whole experience out. Yeah, we can also have PCOS as well. So PCOS is also a commonly diagnosed experience for a lot of people nowadays, starting to get a bit more traction. Like endometriosis was heavily under-researched and undervalued. PCOS is starting to make its way up in the experiences of people as well.
Yeah. Can you just tell us what that means for those who don't know the term PCOS? Isn't that
polycystic ovary syndrome?
Thank you. Yep.
Yeah. So that is a really complex experience for a lot of women and a lot of vulva owners. Another really interesting one from deep internal pain, which is again growing in terms of its prevalence, is IBS, irritable bowel syndrome.
Yeah, and I guess people don't even really think about that, how it could relate to your sex life, but it really can.
Yeah, I see a lot of clients that enjoy anal experiences that really struggle with IBS and really stop experiencing that kind of sexuality when their IBS is flaring.
Yeah, and if you have, as we were talking about, pain outside of the bedroom, it's not going to help you want to have sex. So IBS, that pain, that bloating, nausea. I mean, there's so many different symptoms, and it presents different ways to different people, but it's not helping. It does not help you want sex, which, just realize that.
Yeah, absolutely. And, monitor how your symptoms go. A lot of people will have flares and will have times when it's not so painful for them. So being able to communicate with your partner about those peaks and troughs and maybe planning some sexuality around that is a really great idea.
Totally. I guess now taking the shift from deep to surface.
Yeah, so the other kinds of pain we might experience is on the surface of our body. So we're looking outside the lighter areas of our body, so looking at the vaginal canal and the vulva as well. And another really important thing for us to clear up as well is what's the vulva and what's the vagina?
Oh, okay. But I forgot sometimes that we do need to clarify that. Well, there's a vaginal opening and the vagina is inside the body, and the vulva encompasses all of your beautiful bits.
Yes. So actually a lot of people get this really confused and they say the vagina's on the outside, right? Because that's what we're taught, unfortunately, in school for a lot of people, but that's actually not correct.
Yeah, I just say the vulva just encompasses it all.
Yeah. So just being mindful that this will include both those things, but being conscious that there is a difference with those things as well. And, it is interesting. A lot of people don't know that difference. So just worth clarifying for everyone.
That's true.
So what can we have on the surface or the outer levels of the body? We can have skin irritations like eczema. We can also have, and I see this a lot with clients, thrush and chronic thrush too, really low underlying levels of thrush that creates pain specifically sexually that can lead to some of the more complex pain symptoms, which we'll talk about later as well.
Yeah. What not so common one that I do actually see a lot of, though, is lichen sclerosis, which is usually misdiagnosed as, that eczema or a thrush sort of based condition where it's actually just the cells and the skin just taking over.
Yeah.
And it's really important to have that diagnosed properly. Just a heads up on that one.
Yeah, absolutely. And getting yourself to a sexual health expert is a great chance, a more welcoming space to get some more detailed discussions and diagnoses around this.
Yeah. And I mean, look, gynos should be able to do that as well. I've had somebody, see their GP and gyno who still weren't able to diagnose it's such a difficult name to pronounce, lichen sclerosis.
Say it fast, Lauren. Say it 3 times.
And so just kind of giving people a heads up on that one.
Yeah. And I guess some of the more obvious ones as well as STIs. So they can really create sexual pain, discomfort when we're urinating as well. Another big one too is bacterial vaginosis as well.
Yeah.
So this is one where you'll commonly have quite a strong discharge and comes with a really particular like fishy smell almost.
A strong one.
It's a strong one. So if you're feeling like there's a smell and there's a pain, get yourself checked out. It's very easy to treat, but also incredibly common around vulva owners.
Totally.
Another reason why we might have pain is we might have something stuck inside our vagina, like broken condoms can create pain. You might have all kinds of things stuck.
Yeah, sponges.
Yep.
The broken condom one, that's actually quite common.
Mm-hmm.
And even tampons, forgetting that you've left a tampon in. There's lots of cases of that. So, it's a normal, you just got to be aware of your vaginal and vulva health.
Yeah, for sure. Another really common experience for clients is having tearing of the lining of the wall inside the vaginal muscles as well. Can be really painful and can create a real attachment for them in their mind as well between sex and pain. Because obviously that pain actually isn't something that's occurred outside of the space, but it's something that's occurred whilst you're having sex.
Yes. And sometimes even some of these issues can happen, childbirth is a whole nother topic, I think, really. What I hear as how clients will describe the pain for the one that you described is like thousands of little paper cuts inside the vagina.
Yeah.
And, and it feels like there's somebody sticking a knife and it just, I'm just clenching, ouch. Hearing how people describe this pain and trying to tolerate PIV while it's just ouch.
Yeah. And whilst we say that sexual pain is common, we're not saying it's normal. We're not saying you should be experiencing it.
Yeah.
And that you have to tolerate it. That's exactly not what we're saying.
Good point.
Yeah.
If you are having some sort of pain, you want to figure out where it's coming from and what you can do, because you should not have to tolerate painful sex for your life. That's just not what you want to set yourself up for.
No, don't be stoic. Don't suck it up. It's something which you can actually work on and you can actually make a bit more comfortable for yourself.
Totally. And there's actually really different, a little bit controversial, but there's so many different modalities that actually do work with helping vulva pain, from, heavy medical to Chinese-based medicines to acupuncture. There are so many different complementary therapies.
Yeah, absolutely. And when we talk about some of the more common presentations, we'll start to look at some of the toys that you can use around this too. So there's lots of fun things you can play with that support you to have experiences that are pain-free as well. So other reasons why we might have pain on the surface or on the external layers is, again, that there's not enough lubrication part. So that can happen from lack of arousal. It could happen from hormone changes, from pregnancy, from perimenopause and menopause, and can also happen sometimes from certain medicines as well.
Yeah, good. And any time of month. I don't know if you mentioned that, but it's normal to have your vaginal discharge change and your lubrication to change, especially while you're ovulating. You're going to find it, a lot more receptive to your body's wanting to make a baby biologically.
Yeah. So, some of these pain symptoms you might start to track for yourself a little bit and start to see if there's any patterning around it so that you can see where it's coming from a little bit more closely for yourself. And that will make it easier for you to develop strategies to manage it.
I guess diving right into the presenting issues, the biggest one that I speak on is vaginismus.
Yes, vaginismus. So vaginismus is incredibly common, experienced by vulva owners, and essentially it's a really treatable condition as well. So it's something we can actually work with a lot. So there are psychological causes for vaginismus, and there are also physical causes for vaginismus too. So we'll tell you a little bit about what it is as well. So
yeah, well, vaginismus can look like a couple things. So it could be the fear or anticipation of being penetrated. So sometimes this will go hand in hand with virginity concepts. So thinking that sex will be painful and then carrying that into your sexual history and in your sexual life. If you've experienced pain, once or twice, then you might be anticipating it again. Which is a highly common presenting part of the vaginismus that I see and speak with.
Yeah. And I guess just for those of you that have experienced it or that are thinking of what it is, it's commonly described as you're trying to penetrate, but there's like a stop, like a blockage, like you just can't push through. And it's a tightness. Essentially, it's like if you were really stressed and your shoulders start to really tighten and clench, and then they're really tight and feeling really sore. It's like that happening to your vaginal muscles. So they're contracting and getting really tight involuntarily. So you're not choosing to, it's happening just as a process on its own. And that contraction can create a tension, which makes it feel really hard to put any kind of penetration into your vulva and vaginal muscles.
Yeah, I think about it. It's your body really kind of protecting itself.
Yeah.
If you're, back to kind of, I'm already jumping into the psychological factors here, but, if you're fearing or anticipating pain, your body's bracing itself. The vaginal canal is tensing and tightening and going, no, you're not putting anything in there.
Yeah.
So of course it's not going to let, and if anything does go in, it's going to be painful because it's so tense. It's not going to feel good.
Yeah. It's psychologically created in 90% of people that experience vaginismus. It's a psychological condition. So it's based in this fear response. It's your body's response to the fear of the pain. And so for that, it's heavily treatable. And again, vaginismus, a lot of clients come to me saying, I have vaginismus and this is my diagnosis and I have vaginismus. Vaginismus is an experience that you have, like having muscle tightness or having like a really clenched jaw when you're stressed, but it's not necessarily a permanent condition that you'll have forever.
And I think that's a really good thing to remember. It is treatable.
Yeah. I mean, the stats on this are crazy. Some 75 to 100% of vaginismus is treatable. That's a lot.
Yeah. Oof. Well,
yeah.
That just says go out and get some help, guys.
Yeah, absolutely. And there's so much we can do to support you around vaginismus too. And you may find if you have vaginismus, you really struggle also to get things like a pap smear, or you may struggle to go and use tampons or things like that as well. You're avoiding getting your checkups with your gynos because you don't want anyone to go anywhere near that region for you. So if that is you, maybe start looking at getting a sex therapist to work with you around this, because again, it's a psychological experience that is highly treatable.
Yeah. And what I find with a lot of my clients is they don't even want to look at their vulva or vaginal openings, right?
Yeah.
It's this really kind of disassociation from my body's not deceiving me, but my body's not cooperating.
Yeah.
And it's really sad because, you're in a fight with your body. It's not cooperating how you want to. And so, what can often happen is people kind of give up, or, they don't look at their vagina or vulva in a really kind way. Mm-hmm. And so there's a lot of work to then be done on how to rebuild. This is going to sound pretty lame, but rebuild the bond.
Yeah.
Just to go, my vagina's okay.
Yeah, you really do have to, reconnect this experience of pleasure again for yourself and kind of decouple this pain experience, which has become psychologically intertwined with your experience of penetration and sex. And we do a lot of that breaking down in sex therapy. We try and break down the fear expectation path. I think it was Rosenbaum that did the pain response cycle around this vaginismus, where it's like the anticipatory experience of the pain creates the clenching in the muscles, which then creates the pain and then creates the avoidance. So it becomes a cycle.
The cycle of pain, which we are here to break.
Yes.
And let me tell you, the cycle of pain is not an easy one to break, I have to say. It doesn't happen in 2 sessions.
No, it does take some repetition for yourself to kind of decouple this. And I guess the way we lead through this is, of course, we take a mind approach around working with your thought patterns and around, reframing some of the thinking around pain and anticipation around pain. But we also take a body response and looking at connecting you to pleasure experiences so that you are actually able to see that part of your body in a pleasurable experience again.
Absolutely. Just to feel safe in your own body is a really good start. Just to reacquaint yourself with, before you even get to the pleasure is, sometimes it's even just as simple as giving your body gratitude or just getting into your body and knowing that it's safe in non-sexual, even non-genital ways.
Yeah, 100%.
It just really depends on the case.
Yeah, because, PIV or penetration is just one part of sex.
Yep.
All right. And I guess too, when we're looking at toys, there are some toys that you can purchase if you're experiencing vaginismus. You can purchase dilators, which are, varying objects that have varying widths to them. So you can actually increase the width of the penetration that you're doing and doing so in a pleasurable way. You can also get a device called an O-nut, which is like a series of stackable rings. And essentially it makes the person who owns the penis feel like they're penetrating you, but you don't actually experience penetration. And then as you get more comfortable, you take the rings off and it starts to increase the depth of penetration you're experiencing. So there are actually tools that you can use to explore penetration without being penetrated as well.
Yeah, and that's such a good way of doing. And the other thing to note is pelvic floor physios who work with, they call themselves women pelvic health physios, just for, just to preface it with that, genders. But they do work hands-on. So they will be able to get you to do relaxation techniques to understand how much of your body is clenching, learning how to relax, how to, do you have a hyperactive pelvic floor?
Yes.
And also help and work with those dilators to be able to help teach you to insert. So sexologists, sex therapists, and pelvic floor physios work really well together as a team to help support this.
Yeah, and there are some fantastic pelvic floor physios and OTs out there that work with gender diverse people as well. There's a few places here. If you want to get in touch with us, we can refer you to some of those clinics, particularly here in Melbourne.
Good point. Because, for any, for non-binary, right, because we know gender.
What even is gender?
Right, but, they will be advertised. What I've seen is usually a women's pelvic floor physios or even post or prenatal who specialize in it. So, but they still are excellent at being able to work with these issues. So that's just a side note.
Absolutely. So let's look at the other main presentation that we see with vulva owners, and that's vulvodynia. So this is different to vaginismus in that this is primarily the outside components of your vulva.
Yeah. So usually what I hear is vulva owners will talk about stinging. So around the vagina opening, if pressed, it's going to sting or be painful.
Yeah, so we're looking at, I guess, the labia and the outside components and that real resistance to touch of any kind. And,
if we know that most vulva owners prefer outer play, right, in order to achieve satisfaction, arousal, and even orgasms, then imagine how impactful this would be if just touching hurts.
Yeah. And again, there are psychological reasons for this. We can have trauma. We can have, experiences of painful sex and intercourse creating a fear and aversion response. And we can have physiological reasons for vulvodynia as well, including STIs, including cutting potentially.
Yeah. Ouch.
Now, there are some as well for penis owners, of course, far less low in presentation. So we have infection, STIs, thrush allergic reactions, spermicide reactions, latex reactions, tight foreskins and tears, and inflammation, testicular pain and swelling.
Yeah, I think the biggest penis owner pain that I usually see presenting is my guys with phimosis. So if you're not familiar with that term, it's just a really tight foreskin. So if it's pulled back, they can be micro tears in the foreskin, which again, back to those little micro tears, just doesn't sound pleasant. And sometimes that could then cause erectile dysfunction, obviously. So,
yeah, again, with penis owners, again, if there's any kind of pain response, we have a fear and aversion to that pain response. And we know there's a huge psychological component to erectile capacity. So it can really feed into this loop of fear and then erectile capacity. And then people say that they have erectile dysfunction as a result of that.
Correct. So, I guess, genitals aside, it's experiencing pain and then thinking about that and anticipating that, which is normal, but it's going to keep you in a cycle of pain that you need to figure out how to get out of.
Yeah, we're looking to break that cycle, understand it first and then break it, and then reestablish a cycle of pleasure and intimacy with you and your partner. That's the work we do.
Well, so if you're experiencing pain, please look after yourself, get some help. There's support.
Yeah, know that discomfort is part of the process, but pain is never something you should accept.
Absolutely. Thanks, Lauren.
Thanks, Lauren. Thanks for listening.